All right, good evening, good afternoon. Thank you so much for such an enlightening presentation. I learned a lot just listening to this. So this afternoon, we have the pleasure of hearing from our distinguished panel of people who are experts on this subject and have spent a ton of time either working in the field or researching it or helping to change cities and societies all over the globe. Before I bring them out and introduce them, I want to tell you how fortunate we are to have them. I think Miami as a city provides a great context for what we're about to do. It's a great context in the sense that Miami is a city where people are basically determined to thrive and survive and do really well. It's a city that continues to attract a significant number of people from all over the globe. That's another reason why this city matters. But as you all know, as cities grow, as the level of complexity increases, what becomes apparent is that there has to be some kind of a strategy for managing complexity, especially at those times when we are assaulted by the tyranny of disease, the consternation of events, climatic events. All of these are reasons why we must invest in the whole notion of a smart city. And when you add the layer of wellness to it, I think it takes us to a totally different place. I'm especially fortunate and glad to be a part of this panel. So let's not waste much time and bring them in bring them here to the stage. I think you have to agree that the ultimate truth is that a city is as smart as it is healthy. That's just a universal truth and something that we all acknowledge. So let's dive into it. Derek Duzoglu, please join the stage and take a seat.
Where would you like me to sit?
You could sit
Here?
You could sit here.
Here?
Yes. I'm going to be asking each panelist to give it a couple of minutes to talk about themselves. I really want you to get to know them and the knowledge and expertise they bring to bear here. Egea. Eddie, please. Thank you. Manlu. Yes, please, welcome. Thank you. Helena Solo-Gabriele. Yes, please. And you, son. Welcome. So here's our panelists. Yes, welcome them. Thank you.
We'll pass it along with the changes.
Awesome. I'm going to be asking them to talk about themselves, and please do not hold back. I really want this audience to know where you have been and what you have done. I think it's important. It gives this not just validity, but context in a lot of ways. It also helps to inform the questions that I hope to pose to each of them and to all of them as a panel. So why don't we start with something that's general enough? And here we're going to ask every panelist to comment on the same question. I want to start with the question of challenge. What are some of the challenges that you have seen or that must be overcome by society in order for this conversation to have legitimacy? What are some of the challenges that we must overcome in your individual fields and generally speaking with regards to smart city? So why don't we just go in this order if it's okay, and then we could mix it up. Yes, please, Manhu.
Everyone. Yeah, so great question. So in my field, by the way, I just want to give a little bit background where I'm from, so that it's related to what I do. I'm currently a machine learning scientist in Abridge, a healthcare AI company. As some of the audience know that I come from San Francisco, it's a pleasure to be here, even though the flight is long. Yes, so in our company, what we do is that we build a healthcare AI products for clinicians and patients. So we build node generations app for clinicians, and also we have the clinician decision support system that can help clinicians to do better diagnosis. We also do like billing code generation for the insurance support. So all of these are great to simplify the workflow in healthcare AI domain. So one thing that I think it's kind of challenging right now is to do education. So like lots of the keynote speakers and also some the previous panelists also mentioned that human in the loop is super important. That's why every time we generate the notes for the clinicians, they always need to verify before they send to the Epic system. But for the patient, sometimes it will be a little bit hard to verify what has been generated by the AI model, because we are not the experts in the clinical domain. So I think public health educations will be a first step that we need to educate like more normal people so that they can do better verifications of the nodes generation by the AI.
This is great. Thank you so much. As you can hear from her, the technology is vital, the models are essential, the algorithms are useful, but all of that would be useless unless and until we recognize the role that humans play, the impact it has on human beings. And thank you for saying that. Yes, please. And tell us about yourself and, of course.
Thank you, Dean. Good afternoon, everybody. My name is Derek Duzoglu. I'm the founder of Blue Current. For those of you that were here a little earlier, gave a little presentation and some background. Essentially what we do is we focus on integrating critical infrastructure into shipping containers so that they are mobile and modular. I think given the expertise of this panel, I bring a little bit of a different perspective. Our core focus is on sustainable development for remote communities, but the application here also that I see very prevalent is what we do in terms of emergency response and disaster relief. For those of you that are native to South Florida, you've been here for a couple of years. I know I've been through a couple of hurricanes, and one of the things that we always get this public service notice is, hey, boil your water. From a health perspective, one of the first things that goes off the shelf during hurricane preparation is water. And a lot of the times we're left without, or we're left with poor quality. So, that's one of the challenges that we're looking to address. And as somebody who's passionate about sustainability and efficiency, we want to do that in a way that offers solutions that are sustainable, that have longevity, and that provide these basic solutions for people. And then on the other side, with these small remote communities that we're working with, we have a project going on in Jamaica with a school, we're doing one in Haiti. They simply don't have access to basic water and power. So a big challenge is the educational component, because you could, and I had a wonderful conversation with somebody earlier, and their concern was, okay, great, you drop in a solution, but if you don't prepare the person to maintain, then the effectiveness of that solution loses out. So, there's an educational component, logistics, and those are some of the things that we're dealing with and we're looking to solve by offering something that is very small scale and modular, very decentralized, which I'm very much a big fan of. We like to call them nanogrids. So that's our approach, and definitely an uphill battle with some of the things that we're looking to address, but absolutely excited for the potential. Thank you.
Thank you so much. Ed.
Test. Well, thank you. Good afternoon. I would like to start by saying that I'm a proud dad of a Foot Fellow Honor student in the Herbert School of Business in the University of Miami. So
Congratulations, yes.
what a great place. So thank you. Before moving here to Miami 20 years ago, I lived in the San Francisco Bay Area, helping design the hospital of the future for CPMC, California Pacific Medical Center, as a Sutter Health affiliate. That forward-thinking, visionary approach, we brought it down here to Miami, and I've been helping UHealth on several projects. Some municipalities, like the municipality of Bay Harbor Islands, Sam is right here in the room. Sam is an alumni. Hi, Sam. The city of South Miami, in visionary projects, not just healthcare, but public safety. And what challenge I have run into a lot is when folks in your meeting say, we've always done it this way. Isn't that terrifying? How do you react to that? So part of what I do is try to guide them in, you have to be kind of like a therapist or a psychologist, trying to guide them into stepping into a place where it's outside of their comfort zone. So what I presented this morning to some of you was this drone-inspired concept for a hospital, and how air mobility, automation, and AI is changing not just how we plan our facilities, but our cities.
I love it. This is wonderful. Some of you may know this, but about 67% of people who go into the emergency room at a hospital end up needing or requiring some kind of imaging, X-ray, MRI, or something like that. And so one of the things you see immediately in the design of hospitals, especially the emergency room, is the fact that almost always in a great design, the emergency room is adjacent to some imaging department. Thank you for making our city smart. Yes, Helena.
Thank you very much. I'm Helena Solo-Gabriele. I'm a professor at the University of Miami within the Department of Chemical, Environmental, and Materials Engineering. And in my research, I look at the links between the environment and human health. And as a result, my research is very focused on public health. I think of public health from two dimensions. First is the exposure. How does the environment expose humans through water, air, and earth? And then I also think about the environment as receiving information from people, from communities, and we can gain a lot of information from our environment to understand what's going on inside the community. And so to answer your question about challenges, how does the environmental engineering area focus on it, and how do I look at it? I think a major challenge is we know that there are changes happening in our environment, and these changes do impact our well-being. It impacts our exposure to contaminants, and we need to be prepared for it as a city. How do we get ready for those? How do we come up with new innovative ways of minimizing exposures that we know are coming? And then the other way is, as you mentioned at the very beginning, disease is huge. We had COVID-19, the world stopped. But through COVID-19, we did learn there's a new discipline called wastewater epidemiology, where we now can track disease in communities through the sewer system. And now we know where outbreaks of not only COVID-19 are happening, but we can look at all diseases through our wastewater. And how about addressing that challenge of disease transmission? I mean, disease transmission was at the forefront for so many years for us. So can we design a city smarter so that we can stop disease before it spreads? Thank you.
Thank you so much. Wonderful. Shu-san? Yes.
Hi, good afternoon, everyone. My name is Shu-san. I right now sit on faculty of Miami Harvard Business School. My research is about decision making in real time in the presence of uncertainty. So, which in Miami is pretty much every day. So I look at systems like call centers, smart manufacturing systems, some other things. I come from operations research, so I build mathematical models, algorithms to help conduct performance analysis and optimization. So basically, those problems are the ones that a smart city really faces, right? So we're talking about how to allocate or route resources, especially in the presence of emergency, other emergency events. How to pre-position stuff. things like that. And related to your questions about challenges, I'm thinking about situations where we do have ample signals, useful signals from data, as Helena just mentioned. Well, we can pretty much tell or infer what the COVID situation is going just based on looking at the waste water. So I'm thinking about how to add a decision layer on top of data. I'm a firm believer smart city is as smart as the decisions it makes. So I definitely look forward to how to make more informed decisions for our cities. Thank you.
Thank you so much. All right, so we've heard about the challenges. So the next question has to do with looking back a decade ago of this conference. And you may not have all participated in this conference at the time, but this conference has been around for about a decade now. So the question is, as you look back retrospectively, what can you say are some of the significant leaps or accomplishments that one can associate with this conference, to the extent that you can comment on it? And for those of you who may not have been a part of this conference for some time, that's understandable if you choose not to answer this one. But you want to weigh in on it, Ed?
Well, there's two things that have happened between then and now. One is COVID-19, as Helena mentioned. The world stopped, but we did not stop thinking. And the other one is some conflicts around the world, like the war in Ukraine and the actual situation in Iran. And regulations have changed, which are allowing us to do things differently. So culturally, we are radically different than where we were 10 years ago. And I could go into detail, but I would leave it at that.
Okay.
I'd like to add and to piggyback off your comment from COVID. Again, this is my first time participating in the conference, but I think there's a big takeaway from what happened, and that is how adaptable and resilient we are. And there were a lot of changes that had to happen during COVID. I remember my son was in kindergarten at the time, and I was basically spending 4 hours a day doing kindergarten homework and uploading it. So, taking that into context about our conversations today, and having gone through that experience, we need to take that same approach with technology, with research, with innovation, and to be at the forefront of these discussions, to push those things, get them in front of government, to do pilot projects, to come up with drones that attend to hospitals. I mean, all of these things are amazing, and we need to keep pushing and innovating, and to have this kind of open dialogue, I think, is going to be great to increase our ability to build smarter in the future.
Also, from a very specific technology perspective, during COVID-19, the communities came together, in particular in terms of disease tracking. In the past, medical scientists, medical doctors, they have incredible technology, but during COVID-19, they became very interested in how the disease was transmitted. And the exchange of information and the advances in the technology during that period of time are amazing. The things that we can do now, technologically, in terms of tracking disease versus the technology that we had beforehand, is night and day. We can now take just like forensics, where we now can take DNA from people and find the person. We can take it now from the environment. We couldn't do that before. And then track what's going on and where it's moving in the environment. It's a whole new perspective. And it only happened because we had people from all these different disciplines just focused on trying to address the issue of disease transmission at that time. And as a result, we're much more much more advanced in the actual technology of measuring things.
Shu, a tremendous amount of data was clearly generated by the events of the last decade. But I wonder how you see our ability to manage that data and to extract insights that are powerful, and what someone in your field could do with something like
Thank you. That's a good question. I would say, well, I want to briefly add to the COVID. If I recall correctly, actually COVID, for Miami especially, COVID came with a hurricane. So when people make decisions, by the way, I do admire our cities in the sense that if you look at individual systems, people are making, good decisions. However, that is not enough, right? So going back to 2020, where we had the city has a hurricane plus a COVID. So, well, think about it, right? The hurricane came, right? The power is down, the power grid is down. Hospital was infected, cannot be functioning very normally. We basically we're looking at the cascading effects where the failure in one system actually impacts another. So, instead of making decisions individually, we do want to make joint decisions, right? When I make a decision, I want to share some useful information with you, or I may share, what incentivizes my decision so that you know what I'm thinking and perhaps help you make a better decision. In terms of data, going back to your question, I do think we have ample data. Actually, the large language models we look at, ChatGPT, Cloud, they all build on a massive amount of data. I have this fear because people keep loading their private data onto those platforms. How can we protect, right? How can we protect the individual data while making sure that everyone benefits from this sheer, huge knowledge pool? In my own research, there was this account-to-init phenomenon. Sometimes using less data is beneficial. You do not want to make your model algorithm to be too sensitive to the inputs. Sometimes you want to build some robustness into it. Just add some regularizer so that in the presence of outlier, your decision is not jeopardized by that particular adverse event.
Excellent point. One way to expose the fragility of a system post-disaster is to look at its healthcare imperatives. And I think in the wake of COVID, there was clearly a focus on the healthcare system, what it could or could not do. So I wonder, Manlu, if you could comment on the gaps that became apparent as a result of the failures that COVID exposed. What were some of the gaps, the things that became apparent as weaknesses of our cities?
Yeah, so actually, one thing that I think about COVID right now, like looking back in 2019 when it suddenly burst the COVID, I think right now, if you already noticed that there are some, like on your phone, there are some earthquake alerts or flooding alerts that's happening a lot in San Francisco. So we get those alerts in our phone right now. Like going back to that time, I'm thinking if we can do these preventive actions earlier, like we monitor the data from wastewater or whatever air condition, if we can detect some abnormality earlier and also alert people, is it possible that we can stop or at least do better preparation for the COVID? So that's something that I have think about. Probably we should not just looking at one data source, but multiple data sources. Let's say when we look at one data source, the patterns might be very weak, so we didn't capture that. But when we look at the whole picture, like the different data sources of that city, even more global, not only one city, let's say Wuhan, detect the COVID in some way, and then it share the news to the world more quickly. Can we do better prevention?
That's wonderful. So the public health implications are always something we pay attention to. It's not just the individuals whose health fails, but it's about the public, a region, a group of people. So I wonder if you can each comment on the public health implications, the ability to reach and monitor what's happening with large groups of people within cities. Whoever wants to take that on first.
I would like
You
to
could start,
give
Ed.
it a shot. Well, we all think back of the times when COVID was at its peak, the hospitals were full. And you may have seen that, Baptist Health, Nicholas Children's, were setting up extra beds in their parking garages so they could take in all that extra load. Since then, Congress has passed acts that allows certain levels of acute care to be administered at the home. So that is how our public health is being modified, so that nobody's left behind, nobody's left out. And before, we used to think of this drone-powered hospital. Now we think of this drone-powered city, because now rather than us going to this hospital destination, the healthcare services come to us. So that's another way of seeing how public health is being modified.
That's powerful. Who else wants to weigh in on this? Public health.
I'll add a little bit of what Manlu said really resonated with me, and it's becoming more proactive and less reactive. And I think to the extent that we can leverage data and analytics to put systems in place that allow us flexibility to address issues before they become detrimental is huge. And again, this kind of ties into the work that I do with decentralized systems, the ability to have those to rapidly deploy, that you're not waiting weeks or months for fresh water or for renewable energy. If you can have systems in place that essentially become mobile assets for municipalities, that's huge. And again, taking that shift to we're waiting last second and learning as things go, okay, great, but we have had these experiences. Let's use that data collection, let's use those analytics to study and analyze situations, and then have things that are readily available to deploy to mitigate the harm long term.
Yes.
Yeah, also reflecting back on technology, as mentioned, we learned very well how to communicate now through the computer with virtual, for example, even telemedicine now. Before we didn't do that virtually, and now we have some appointments that are telemedicine. And I think we could couple that ability to now that everyone's more comfortable using the technology, to put another layer, as mentioned, on the healthcare. My sister, she's a pediatrician and she does telemedicine, and she always tells me, oh, if they only had a stethoscope, or a little device that I could see in the ear, and she talks about how it's only $30, but how do you get it to the individual? And maybe with drone technology, it could be flown over. Somebody, have an appointment. Well, let's take a look at your ears, and the equipment is sent over.
That's right.
Kind of thing. So maybe, thinking in that route, how do we facilitate doing better virtually with materials that may even be needed? So, thank you.
Sometimes as scientists and engineers, our tendency is to latch onto our solutions and our brilliant ideas, and almost always totally ignore the human implications, one of which could be the ethics of what we're seeking to design. So I want to take you to the subject of ethics as it affects the design of smart cities. We all know now that you're armed with great solutions and ideas, but can you speak about how thoughtful these ideas are and how ethical they are, and to what extent we take into account the human dimensions? So let's talk about the ethics.
Well, you can't talk about ethics without talking about privacy. And I think that the more technology there is, the less privacy we have. And one example is I was recently involved with the Real-Time Information Center for the city of Miami Beach, and there's 550 sensors throughout Miami Beach. You cannot move without being seen or heard. And there's drone technology in the roof of the Miami Beach Police Department, that anything that happens, a drone is deployed immediately. So, I try to predict that there might be a future legal clash between our healthcare systems and our local government. Why? Because we're going to be seeing drones flying all over the place, and someone has to keep a watch and control over that. It's not going to be the Miami Airport Air Traffic Control Tower. It's going to be our local municipalities' job to oversee that traffic. So who calls the shot? The city or this health system.
Interesting. Shu, can you comment on ethics as someone who looks at tons and tons of data on a regular basis?
Okay, absolutely. I do want to share. I originally come from China. I don't know how many of you have been to China lately, especially after the COVID. For one thing, there were a lot of surveillance cameras all over the place. Okay, I can tell you, I'm not exaggerating. There are over 100 surveillance cameras just in one metro station. So on the one hand, people are concerned about privacy. Everywhere you go, you'll be observed, constantly monitored. But on the other hand, I have to say, the society is extremely safe, way safer than many of our cities. So as far as I'm aware, a lot of our cities, cities in the States already, also installed a lot of surveillance cameras. So basically, those cameras help our police, to identify cars that was, labeled as stolen, something, wrong. Basically, if a car drove by, that camera automatically, pick it up, right? Notify the police and get people caught. I know, here, people in the States keep talking about this. Well, on the one hand, society becomes safer. On the other hand, my privacy, people's privacy are violated. So this is indeed something I also, cared about, and also, I think I do have a perspective, unique perspective to share, given my own background. I don't see absolute right or wrong, but I think we definitely need to strike a good balance. Preserving people's privacy will also ensure we do have a safer society. Bad people get caught, right? And good people still can live their lives normally. Yeah.
Well said. Yes, Derek.
All right, if I may add, thank you, Dean. I think it's a great question. Putting a slightly different lens, I think, we have a huge responsibility to make sure that there's also accessibility and inclusion when we talk about these types of solutions. We have an ethical responsibility because we don't want to put systems in place that will only allow access to these benefits for a select few, but for everybody. So to take that route and have that bigger picture lens where, okay, this is a fantastic solution, how do we make sure that anybody that needs it or wants it can access it? And I think that's a big piece of the puzzle and the conversation also moving forward.
I would like to add 2 points regarding the data privacy. So in my job, I train the model. So not just use the OpenAI model or cloud model. So when we train the model, one thing that we definitely need to do is de-identify the model, de-identify the data. So that's super important for us. And without that, we will never be able to train our in-house model. I hope that OpenAI are doing the same. That's if they use their user data to train their model to become better, hopefully they have such kind of regularization. Another point that I also want to mention is, so when I start my job, I always do the data privacy training. So I noticed that what kind of data in medical domain is sensitive that we cannot directly use. And I would say that it's also such kind of training is important for regular people as well. I don't know when it will happen, but one idea I have in mind is that, let's say that AI or this LLM model become more and more accessible to regular people, probably such kind of training will also be important. Let's say whenever the people start to use ChatGPT, onboarding, they need to go through some training. You need to know how to protect yourself, what kind of data you should not share with the model, or what's the risk of sharing those data. It's not happening right now, but I think it could be a good way to go.
That's wonderful. Now I want to hear from you, Helena, as well.
Also, on data privacy, even when it comes to measurements of the environment, such as the wastewater, we can get down to the building level to identify whether or not the individuals in this building are sick or not. And so just having a community know that this building is an issue, that causes concern. It may alter behaviors, it may stigmatize the people in that building. but we're getting to the point where we can get down to very specific information where in our samples, we can see human DNA in there, and we can identify who from that human DNA and associate the disease. So we're getting to a point where we can do measurements and associate disease with an individual just from the environmental measurement. And so how do we get to a point where we maintain data privacy, where we don't release HIPAA-related information about people's illnesses from the environmental materials?
So before I go to the audience for questions, I wonder if you can comment on the role of ChatGPT, generative technologies, in the context of smart cities, Gemini, ChatGPT, and any of those tools. If you could briefly comment on it, and then I'll turn it over to the audience. Anyone?
I want to start, if I may, because I have so much to say about ChatGPT. So I can share with everyone how I use those AIs. So I use both AIs, the ChatGPT and the Cloud. As you know, Cloud is extremely good at writing, right? Creative writing, coding, etc. ChatGPT, on the other hand, is extremely good at reasoning, mathematics, and so on. So basically, every time I have a good idea, right, some good research ideas, I will ask Cloud to write a templates, write paper, make up a proposal, showing me the feasibility of doing this, right? Writing the paper, I mean. Then Cloud gave me a draft, initial draft. Sometimes, be far from being perfect. I then sent the initial draft to ChatGPT and asked ChatGPT to write a referee report. Okay, I then feed the report back to Cloud and ask it to revise the paper. So, I do it after several rounds. Ultimately, I get a paper with which I can start working. So it does save a lot of time. So basically, I now have an army of PhD students working with me, even without really having a PhD students. Okay.
That's interesting. But how are you relating all of this to a smart city?
Okay, so as far as I know, in a lot of areas, a lot of industries, people are also using ChatGPT, Cloud, some other platforms. I'm a firm believer that these type of tools only make more powerful. People more powerful instead of replacing us. It's like I'm operating a super robot that can pretty much take care of everything. Especially the tedious, stuff. I can focus on, more important stuff. I do think those tools improve individuals' well-being, and that collectively, improves the society as a whole.
It's wonderful.
Yeah.
Yes.
Regarding Dean, regarding smart cities, something that we may not have a sensitivity for yet is we're going to be competing for space. Meaning, moving here from San Francisco 20 years ago, I would walk by a huge, 4-story building with no windows, and I would ask my colleagues, "What is that?" And they said, "A data center." And back then I was like, "Why do we need that for?" Today we are clearing green fields to build data centers, and in a city like Miami, where we are surrounded by water, we're landlocked. Where do we build those? Where do we go to provide that so that our city becomes smarter within our own boundaries?
On the note of the smart cities, I serve as the chair of the Sustainability Advisory Board for the Village of Key Biscayne. Maria is one of my board members. She's right there. Thank you for coming. So, obviously we're dealing with a much smaller footprint than larger municipalities like the city of Miami, Coral Gables, on the county level. But one of the things that we are doing, and any of those that view, which many of you do, have science or engineering backgrounds, that data and information is exceptionally important in the decision-making process. So one of our roles and responsibilities as board members is to engage with the community, study and look for solutions, and then present those to Village Council to give them information to then make informed decisions on viable projects related to smart cities. For example, we just gave a presentation recently for them to replace their diesel generator, which runs the backup systems for fire and for police, with a completely off-grid solar and battery system, and to also include some desalination capabilities, so in case the village loses power or connection to the island via the bridge, they're still operational and they're off-grid. So to that extent, AI has been tremendous in providing simple, nothing overly complex, but information, historical data, where we don't have to spend hours going to the library and looking up information, but we have that access at our fingertips, which then makes our time more productive in analyzing and looking for these types of solutions.
Okay, I'm going to turn it over now to our audience who has a question for our panelists. Yes, please. We have a mic coming to you.
Thank you so much. All right, guys. Appreciate the talk. It's been amazing. I wrote down 2 questions. So first I have a question for Mon. I wanted to ask, do you feel current HIPAA regulations are sufficient for this new generation of AI? Are there gaps that still need to be addressed? And then I have a question for Dr. Sun. In emergency response systems where decisions are made under uncertainty, how do you balance speed versus accuracy when designing real-time algorithms, especially when scenarios could lead to loss of lives? Thank you.
All right,
So
we could start. Yes.
Yeah, maybe I can start. Definitely, I actually learned a lot from my HIPAA training regarding the data privacy. But one thing that I noticed is that this training is just in the beginning. And then, like, when I do this training, I know what data are, like, private and we cannot directly use them. But it's actually not integrated in our workflow. But if it can be integrated in our workflow, then it can make sure or be more safe that when we develop this, whatever the AI tool or the product, that it can actually follow the HIPAA train. Yeah, that's the one gap I see.
It's wonderful. Sure.
Thank you for the question. So related to emergency response, I do want to add that this is actually a 2-stage decision process. The first stage, before everything realizes, before the hurricane came, right? You sort of need to figure out where to pre-position, resources, medical stuff. Realizes you have to make another decision on the fly, right? How to dynamically route the resources depending on which area is hit most heavily. So before this realizes, you can analyze, let's say, using simulator to simulate the different scenarios. Well, let's say you have 10 candidate solutions at your disposal. You just pick one out of the 10 and run different scenarios and see the outcome. You can average over all possible outcomes and obtain an overall evaluation of this solution. You then compare the 10 solutions, the outcome, the performance of the 10 solutions, and pick one that gives you the overall best performance. So this is one typical approach people can take in this types of problem. For the second one, I think big data, those AI, these are exactly what makes this possible. We don't make decisions based on information 1 month ago. We now make decisions using information in the last minute. So I think this is something we now can achieve.
Okay. Yes, please.
Thank you so much for being here. My name is Nurçin Çelik, and I'm a professor in the Department of Industrial and Systems Engineering. This is a wonderful panel, in my opinion. I wanted to follow up on Dr. Sun, on your opinion about making the decisions on real time and the dangers of it, actually. So let me give you an example to explain the problem that I have been thinking about while you were discussing the mass surveillance, the AI-based decision-making, and everything that goes with it. So for instance, let's say there's a fire in some part of the city, and we do not receive any call or any type of information, specific information about it, but we sense it. Before the abnormality happens, I'm not sure, we sense that there is some type of abnormality, the smoke is coming out, and we deploy all of our resources to that end of the city, where in fact, the problem or the actual fire was going on the other side of the city, which is basically cyber vulnerability, right? Cyber attacking. So how do we prevent that especially when we are making decisions in the real time, when we are using the data at this second and not going back to the historical data. So basically, how can we trust the decision making of the AI when we know that if we train it well enough, it's going to give us accurate data? So it's going to prove itself that it's given you an accurate data where in fact the data is flawed. So could you comment on it a little bit?
Thank you for the excellent question. By the way, it's nice to see you again. Several years ago, you actually gave a virtual seminar at UF, where I previously worked. So yes, I definitely recognize you. So quick question. First, I have to be honest. I haven't yet given much thought, to the reliability of the data, the signal and so on. But it does remind me of something I was talking about earlier. It seems to me that it's highly non-trivial to turn signal into real decision making, right? So think about the occupancy level at the ER, right? At what level you initiate something? 75% or 90%, right? Or the wastewater scenario. At what level you actually initiate some precautionary measures, right? So if you act too early, you have the risk of wasting resources. If you act too late, it may cost lives, as the situation you just depict. So to be honest, I don't have a very specific answer to that, but I do feel this is very important. How and when to turn the signal into actions. Thank you.
Wonderful.
Maybe I can add a little bit to that.
Please.
Yeah, because that's actually also a concern in our company as well. So what we actually do is that whenever we give an answer, like in the clinician decision support, we always cite the source where this is coming from. So that could make the answer from whatever the model more trustworthy, reliable, so that human can more easily to verify rather than out of box. So that's one thing.
It's wonderful. Now, with regards to health and wellness and with regards to smart cities, what keeps you awake at night? And think of that as a next step question. What happens next? What worries you the most with regards to health and wellness as well as smart cities? If you could just comment on it quickly, and we would probably begin to wrap this up.
I guess
I'll hear from all of you.
I'll start with that real quick. I mean, obviously, I have a passion for what we do with water, but this, I think, has a big implication with the discussions that are going on with the resource requirements for AI. And a big part of that is cooling, and the cooling comes with water. So, there's been conversations happening throughout the country where some places are experiencing issues because they'll put in this data center and all of a sudden there's a lack of that basic resource for the residents in the area. So, when we're looking at building smart, we want to make sure that there's that delicate balance that, okay, we're employing these tools and these technologies to help make the, life better, to improve the quality of life. But we have to do that with a real focus on balance to make sure that we're not subtracting from one area just to add to the other.
That's powerful. Okay, I want to hear from all of you. Yes, Ed, if you want to go
Dean,
on.
when it comes to health and wellness, I become very selfish, and I cannot escape the adding to that health, safety, and wellness. And for the past 4 months, I've become acutely sensitive to our vulnerabilities, not as a country, but also as a community, and being able to be self-sufficient and not rely on foreign powers for our health and wellness. So making sure that we have the systems in place locally so that we can continue to operate without, having someone from outside of our borders pull the plug and hurt us.
Wow, very good. Thank you. Yes, Helena.
Yeah, I was reflecting as well. I mean, in addition to my area, which is environmental, the whole question about AI and artificial intelligence, and as I was reflecting on it, smart cities need smart people. And in terms of in this world of artificial intelligence and where we as faculty are to impart and help students grow, it's becoming very challenging to really know, are they being educated? What are they providing us back? And how do we evaluate it so that we know that we're imparting knowledge, that the students are not, making things, cutting corners and giving us materials. An example I have is I'm teaching a class. I have over 20 students, and they were to provide me with a report, a 2-page report. 3/4 of the reports were the same. They were very similar, and I was like, this is not right. So how do we make sure that our smart cities have smart people? And I think it's the underpinnings is the education and making sure that when we teach, we're evaluating the students that they really are truly learning. And I think that's a huge challenge. Thank you.
Thank you for sharing that. Yes.
Thank you. So I will be brief. I think a smart city ought to be human-centered. Okay, human ought to be in the center of everything. I just want to briefly share one example. Several days ago, in an apartment building I live, I saw several drones performing the high-rise cleaning instead of people. I didn't know people can be so creative using drones to do these type of things. So I do believe we can be more creative in terms of how to make a better use of the technologies, the data, to make our lives better and safer.
Okay. Yes. Please.
Yeah, I will also add one point that's probably not keep me awake, but keep many people awake is whether one day AI will take their jobs, right? So I actually get this question a lot from my friends, and they're worried about the future like that. So what worried about me is people too slow to adapt to AI tools. Like the speakers have mentioned that AI is a great tool to make our work more efficient. It will replace some jobs, of course, but not just replace totally. So let's say the constructors, now they can use AI to estimate. So their job is more like verify. We still need to verify whether the estimation is correct or not. So they are not totally replaced, but it's important for them to adapt to how to use AI tools. And that's not like easy for everybody. And we kind of lack of that kind of training as well. So I think that's probably a worry for me.
Okay, how about a round of applause for our distinguished panelists? Thank you so much, and thank you to our audience. And that's the end of the session. Thank you. Okay, absolutely.
As we come to the end of today's conference, I would like to take a moment to reflect on today's fantastic event. So smart cities we have seen that smart cities have evolved with new technology. So we've seen new sensors today, new hardware and software, and also new services. We've seen that smart cities has make our lives healthier, make our infrastructure stronger, and delivering new services. But we have also seen many challenges. So today, many panelists mentioned the adoption challenges, also the privacy issues that hinder the adoption. So that's why our conference today is trying to bring together researchers, industries, and governments. We are going to work together to try to make the technologies to have real impacts. And finally, I would like to thank all the keynote speakers, panelists for their insightful talks and discussions. And I would also like to acknowledge our fantastic staff, Eve, Francis, Saab, and Justin. Without them, we would not have this conference today. And finally, I would encourage everyone to go to there is a nice reception out there, and yeah, that's all. Thank you for joining us today.